Hello, welcome. This is a video I'm putting together just as an introduction to the bone list, because I know first looking at it, it can be quite overwhelming. So this is just a way that I wanted to, what I would normally do in a lab. And I will also do this in lab next week, since this is the 12th. Everybody just got done taking their tests. Way to go, good job, everybody. But I wanted to give you a head start. So if you wanted to jump into the bone list this week, week 4, awesome. I highly encourage you to do that. My bone list is a little bit wrinkled because I just shoved it into my bag after class today, but that's all right. So what you'll see is the bone list is broken up into different sections to try to help make it easier to study. So if you'll notice, the first section is microscopic anatomy, and then there's a section on gross anatomy, and then we start really getting into the skeleton, the bone names, bone markings. So you'll see it's first broken up into the axial skeleton, and then we do that for a page or so. And then we get into the appendicular skeleton, and then that goes into a little bit on the 3rd page. So that's how we are going to break it up. So next week's lab, so Monday's lab in week 5, we're going to cover microscopic anatomy, gross anatomy, and the axial skeleton. And then the Monday of week 6, we're going to cover the rest of the bone list with the appendicular skeleton, and then do a little bit of joints and articulation. So that's why it's so important to use this time in week 4 to get a head start. Now, I wanted to draw your attention to how the bone list is organized. So if you'll notice, under the cranial bone, so this is the first collection of bones of the skull, we have the name frontal. Frontal is the bone name, and then tabbed over a little bit is what we call the supraorbital foramen. This is what we call a bone marking. Okay. So for the frontal bone, you need to know 2 things. You need to know the frontal bones, you need to be able to find where that is. And then you need to know the supraorbital foramen, which is found on that bone. If we go down, the next one is parietal bone. So it's just the parietal bone. Since it doesn't have anything tabbed over, that's all you need to learn for the parietal bone is just, you got to know where the parietal bone is. The next bone is temporal bone. And if you look, it's got 1, 2, 3, 4, 5, 6, 7 markings associated with the temporal bone. So for this particular bone, you need to remember 8 things: the bone name itself, and then the 7 markings that are associated with it. So that's how the rest of the bone list goes. You have a bone name, and then tabbed over will be its bone marking, and bone name and bone marking, and so forth and so on. Some things don't have any markings, like nasal, vomer, inferior nasal conch. They're just the bones. There's no markings. Some of them have quite a few. Like you can see a big whole bunch of stuff can be found in the mandible. So that's the pattern as we go along. So I'm going to, in this introduction, so I just introduced how the bone list is organized. I'm going to go over the microscopic anatomy. Looks like my phone froze. Hopefully it'll come back here. Nope, it's not my phone. Let me pause the video real quick and see if I can fix the problem. Okay, I just lost my share screen, but I got it back. All right, yes, so I'm going to go over these things in the rest of this video, and then I'll make another video going over all of the details of the skull, okay? So for microscopic anatomy, I'm gonna use a model that we have in lab, okay? So you'll get to have an opportunity to take a look at this in the during lab time. Just peel off a piece of tape there. So I'm going to go over what we can see. See, it paused again. All right, I don't know what's going on, but hopefully we won't get any more frozen screens. Okay, so on our list, I'm just again going to do this first microscopic anatomy. We have osteon, central canal, lamellae, osteocytes, lacuna, canaliculi, and perforating canal. So those are the things I'm going to identify here on our model. So the first one is an osteon. So each one of these circular structures here, kind of seen from the top, is an osteon. If we look at it from the side, we can kind of see osteon here or kind of here. So that unit is called the osteon. And then the opening in the middle is what we call the central canal. So here's one that's hollow, but really the central canals are going to have blood vessels in them and sometimes nerves. So the central canal is inside an osteon. Lamellae are the layers, right? So all the little rings of matrix. These are lamellae, and there's a couple different kinds. You're going to be learning the details of that in lab and in lecture, but I'll show it to you here. So the lamellae that make up the osteons are called concentric lamellae. The lamellae that are found in between all of the nicely formed osteons, so all of this stuff here is called interstitial lamellae. And then around the very outside edge, going all the way around the edge of the diaphysis, is your circumferential lamellae. So those are 3 types: circumferential, interstitial, and concentric. Then we have the osteocytes. Can't really see it too well here, but they're going to be in these little pockets called lacuna. And then the little branches that are connecting the lacuna together are called canaliculi. And then lastly, if we look horizontal, we can see these central canals are running vertical, kind of parallel with the osteons. But then we have running perpendicular to that, these are called our perforating canals. Okay, perforating canals. All right, so those are all the structures. We paused again. All right, hopefully this isn't going to be too confusing on your guys' end, pausing and starting and stopping, but that's technology. Sometimes it works and sometimes it doesn't. And sometimes it works a little bit at a time. So we'll just do the best we can. All right, so those are all the structures associated with the microscopic anatomy, right? So we covered all of those. So next I'm going to go over these gross anatomy things. And for this one, I'm going to use an actual cow femur. So we have this in lab, so you'll get to have an opportunity to touch it and hold it and take a look at it. But this is a cow femur that's been sectioned in half. So we are going to cover the markings or the items, I guess, in the gross anatomy. So the first one is spongy bone versus compact bone. So you can probably really see the spongy bone here at the ends of the bones. And then the compact bone is this thick, dense bone here, really smooth. The diaphysis is the shaft of the bone. Epiphyses are the ends of the bone, right? So if I put the whole bone here, we can see diaphysis right here, or the diaphysis is the shaft. The epiphyses are the ends of the bone. And then the metaphysis is usually kind of a boundary between the epiphysis and the diaphysis. It's also where you're going to find the epiphyseal plate or lines, depending on the age of the bone. So here we can actually see, I think this was a young cow's femur, because we can see a really kind of broad plate. So there's probably cartilage in there. So this would be like your epiphyseal growth plate in this case. Periosteum is going to be this connective tissue membrane that's kind of on the outside. You can kind of see it peeling away a little bit. It's the connective tissue sheath that surrounds the bone. Endosteum we cannot see here, but the endosteum would line the marrow cavity and would line all the tiny little spicules and trabeculae of the spongy bone. It also lines the central canals and perforating canals. Yellow marrow would be found inside the marrow cavity. Red marrow would be found in all the tiny little spaces of the spongy bone. And then cartilage, articular cartilage, would be found here on these condylar surfaces. Now this bone doesn't have any cartilage remaining. This is just bone surface. But this is where the articular cartilage would be, on these smooth surfaces at the ends of the bones. Okay? All right, so that wraps up our introduction, a little bit disjointed there, haha, joint, right? That's kind of like bone stuff. So next I'm going to put together a video covering all of the bone names and markings for the cranial bones, the facial bones, and I have a fetal skull. We'll go over that one. Okay, so I will see you next time.